The broadcast is now starting. All attendees are in listen-only mode.
Hi everyone, welcome to this webinar about how to achieve the Healthy CPS Indicator. We're really glad you have been able to join us and make time out of your busy school day. My name is Rosa Richter and I'm the Director of Chicago Programs and Policy here at Healthy Schools Campaign. And that's the organization that's hosting today's webinar. We'll tell you a little bit more about Healthy Schools Campaign in a few minutes, but first I wanted to quickly review some basics about today's webinar. So today's webinar will run for approximately 1 hour, and a recording of the webinar will be made available to view after today. So we'll send out and we'll email a link to the recording, and it'll also be archived on Healthy School Campaign's website by the end of this week. Also, at the end of the webinar, if you could take a quick minute to complete a quick survey about the webinar, we'd really appreciate it. So just before we get started, I'd like to go over a few logistics. Again, it's going to run for about an hour. We're going to have all this content available online. We're going to have a quick survey at the end. And then we're also going to have we're going to set aside the last 10 to 15 minutes, for a Q&A. So there's actually a chat function on part of the screen that you'll see, and if you can chat in your questions throughout the presentation, we'll make sure to address them right at the end in the final 10 minutes. So with that, we're going to get started, and today you'll be hearing from Christy Cox, who's our training manager at Healthy Schools Campaign, and Sarita Shealy from the Office of Student Health and Wellness at Chicago Public Schools, as well as Kenneth Varner, who's our community engagement manager at Healthy Schools Campaign. So with that, let me introduce you to Christy Cox, and she'll set the framing for today.
Thanks, Rosa. So we're really excited to have you all here, as Rosa said, and thanks so much for spending your hour after a long day of school to learn a little bit more about healthy students. Before we get right into the Healthy CPS Indicator, we want to give you a little background information as to the importance of healthy students. We know, studies have shown that healthy students are better learners. And in fact, Dr. Charles Bosch has done an in-depth study specifically on healthy students. And he states that no matter how well teachers are prepared to teach, no matter what accountability measures are put in place, no matter what governing structures are established for schools, educational progress will be profoundly limited if students are not motivated and able to learn. So health-related problems play a major role in limiting the motivation and ability to learn. And that's exactly what we're going to talk about today, is ensuring that healthy students are better prepared and able to learn. And when we talk about healthy students, it's really talking about the whole child. So just not their physical health, but also mental health around social emotional wellness. We know that there's really it's really an important piece to making sure that students are ready to learn. And so really focusing on the whole child is super important. And that includes consistent messaging throughout the school. So, we talk about their social emotional health, but also when we're looking at messaging around good nutrition and health, that messaging is consistent throughout the school. So that could be nutrition education in the classroom, making sure that there are various posters available in the cafeteria, that they have access to recess and movement in classroom, and that they're free from bullying in school. We also want to touch on chronic absenteeism, which is a big focus for our organization, and it's a huge movement in the schools across the country. We know that students need to be in school so that they're able to learn, and studies show that students who miss 2 or more days of school per month are more likely to drop out. These students aren't just missing school because they're sick all the time. A lot of times those students include victims of bullying. They could be students whose parents struggle to get them out of school on a daily basis because of work or other issues. And then, of course, it does include students who might have chronic health issues such as obesity or asthma. We also look at nutrition as a really important part of keeping students healthy and ready to learn. And so providing nutrition education in the school is really important. And especially because that's where they spend the bulk of their day, every day is in school. So they can be in school up to 8 hours a day. And so really ensuring that they have knowledge and information on how to eat healthy and be more healthy is really important. And then, of course, physical education and physical activity is a big part of maintaining a student's ability to focus. So we know that students who sit in one spot for too long, including adults, if you sit in one spot too long, you start to get restless and anxious. And so really allowing those kids to move throughout the day is really important, not only in PE, but also access to recess every day, and then physical movement breaks in class. Physical movement prior to tests is also known to increase test scores both in math and reading. So really looking at the whole picture and embracing some of these ideas to help your students become healthy and better learners. I want to take just a moment to talk about Who Healthy Schools campaign. We are a Chicago-based nonprofit that works on local and national issues around school health. We believe that healthy students are better learners and work hard to make changes at the local, state, and national levels. We've worked really closely with CPS to encourage them to offer healthier school food. We advocated for the return of recess. We've also encouraged them to use green cleaning products in the classroom to help eliminate any exposure to chemicals, which could, of course, exacerbate any asthma attacks in students and teachers. So really we are looking to find ways to create an overall healthy environment and look for ways to engage administrators, staff, teachers, parents, and students to encourage them to be more healthy. So we need to get started on this Healthy CPS Indicator. That's what all of you have joined us for. And so if you've never seen this before, this is what it looks like, and you can find this on your school progress report. Today, there are 4 badges in the Healthy CPS Indicator: chronic disease, instruction, learn well, and health services. Before and this is something that will be discussed in the first part of the webinar. And then the second part of the webinar, we're really going to focus on the Learn Well badge and how schools can actively make changes in their school to achieve that particular badge.
Great, thanks, Christy. So while I introduce our next speaker, I'm going to launch a poll. And we're just curious to see how many of you joining us today are wellness champions at your school. So just take a minute to answer the question. Are you a wellness champion? Yes, no, not yet, but interested are the options. So today we have Sarita Sheely, and she's a Healthy CPS specialist, and she has the honor of working with many schools across the district to help them create healthy changes at the school level and make those changes sustainable. And she's a great resource in order to do an assessment and create an action plan and make sure you are getting the recognition that your school deserves if you're making these healthy changes, practices, and implementing these practices. So without further ado, let me close this poll. And it looks like 43%, let me see, there you go. So 43% of attendees are wellness champions and 43% are not. 14% are not yet, but interested. So hopefully that can help you out, Sharita. Let me get this off the screen. And there you go.
All right,
so,
thank you.
Thank you.
Okay, so first I'll tell you a little bit about Healthy CPS and the Office of Student Health and Wellness, located here in Chicago. Office of Student Health and Wellness, our mission is to eliminate health-related barriers to learning, to advance the whole child and child health equity here in Chicago. The mission of our leader right now, Dr. Fox, is that every child will have a medical home. And within our office, this is just a little organizational chart. We have 4 big departments: health promotion, focuses on student policies, health education, physical education, school food promotion, school gardens and chronic conditions, health information. We focus on evaluation, communications, and mostly like the data and the purposes for the Healthy CPS Survey. Student health services, focus on the medical portion for students, so vision and hearing screenings. And then we have the children and family benefits unit, and we'll dabble a little bit about Medicaid enrollment. That's a big push for the district right now as well. So the Healthy CPS Indicator, like they stated, we have 4 badges: chronic disease, instruction, learn well, and health services. This is our indicator to focus on health focus measures for the school progress report, and we want partners to identify if their school is meeting the key policies within the district, and this is how we gauge them. So first and foremost, the chronic disease badge. Here we go. So with the chronic disease badge, we are measuring whether schools are effectively providing safe and supportive environments for students with chronic conditions. And the chronic conditions that we like to speak to are asthma, food allergies, and diabetes. And in order for staff to receive training on that, you can always log on the Learning Hub, and within the Healthy CPS Checklist, there is a link provided in that as well, and I can show you a brief synopsis of that. The chronic conditions webinar is 45 minutes, so it doesn't take that long. You just register for it, and also from our office or with the principal, we can do a mass enrollment for you all. We have to do it, or the principal has to do it for the whole school. But that is a requirement that all staff receive this training. For the instruction badge, we are measuring instructional time within the school, and that is for nutrition education, physical education, and sexual health education. The only one that does not have minute requirements is nutrition education. For physical education, the minute requirement is 150 minutes per week, so weekly. For sexual health education, it is 300 minutes for K through 5 and 675 minutes for 6 through 12, and that is annually. So physical health education is weekly of 150 minutes, and sexual health education is 300 for K through 5 and 675 for 6 through 12 annually. For the Learn Well badge, we are measuring how well you provide access to healthy foods and physical activity throughout the day. And we know that Kenneth will be going more into detail about that for you all. So we're looking at recess throughout the day, nutrition standards, physical activity, safe and supportive environments, which is a new one for us that we added to the checklist. And that focus is mostly on providing a healthy environment for all students, but especially for our LGBTQ students. And we're also focused on school gardens and what it looks like to have healthy fundraiser, rewards, and celebration. And I will also note that we work with Airmark to create a healthy celebrations menu for schools. So if you want more information on that, you just contact our office, and you can provide a school-wide celebration menu, or it could be the Healthy Celebrations catering menu for schools. And last but not least, the Health Services badge, where we are focusing on access to direct health care for students. And we provide health services for vision and hearing screening, dental exams, vision exams, and all the state required immunizations and physical exams. How we assess all of this is through our Healthy CPS Checklist. Will I be able to click on this? And great, so this is our checklist. And it is interactive when you download it, and you'll be able to click on the yes or no button. So if your school is meeting the requirements for each badge, or they might not be, and it gives you action steps. So say you have the student medical information distributed every year, so it gives you action steps for that. Let's say you are not meeting the requirement for CPR, or let's go to the chronic conditions training webinar. It will give you the link right here to log onto the Learning Hub to meet that requirement and have your staff register for that webinar that we are requiring. And it goes through each badge. So that was chronic disease. This is instruction. We go through Learn Well and health services. And please note that the action plan is meant to provide you as an assessment tool. That does not mean that you will receive or be Healthy CPS certified. That is based off of your answers that you provide us within the Healthy CPS survey. Okay, and then also with your Healthy CPS checklist, we have the Healthy CPS action plan, and this is where, based off of the answers that you selected in your checklist, you will go and make goals and action steps, and who the lead people are, hopefully people on your wellness team who are going to help implement that and put them in place. And then it's by each badge as well. As far as our office, we provide technical assistance to schools, where our team members or partners will go out to schools and provide you assistance on achieving Healthy CPS. And we also provide professional development opportunities. Those trainings, like I spoke of, can be found on the Learning Hub, as well as through Healthy Schools campaigns, their professional development opportunities, and other outside partners. We also have other resources such as toolkits, letters, samples for parents. We also have a lot of information on the Knowledge Center. If you just type in student health and wellness, you can locate a whole lot of information on there. And we have a monthly digest that goes out every month, giving information on what's going on within our office, what's going on with outside partners who can help provide you resources to meet the requirements for each badge, and as well as just a plethora of information, and also a parent corner to help out parents. We have a lot of information on there as well. And then we just provide other resources such as free seeds for people who have school gardens, and cannot forget our pre-K initiative. So with Startwell, we have some Startwell kits, and there's a Startwell toolkit that will be going out pretty soon as well. Going backwards. How we analyze everything with the Healthy CPS survey. So the survey is distributed in May, and then there's a raffle incentive for those who fill it out speedily. Then we go through the manual review process once we get everyone's survey back, and we analyze the data with our whole team. And then we analyze the data from July to August, and then we send out the reports to you all, to schools, and then you have a follow-up period, meaning you have a chance to contest what was given to you on your report. Either you're like, this was right, this was wrong. Hopefully the right person filled out the survey. And then we go back and on a case-by-case basis, and we finalize the data, and we rerun the reports, and then we submit them to our school quality department, and to let those reports be located on the school progress report, as well as for download on your school page. So, and the 4 sources that we use for data is a Healthy CPS survey. We use impact data that you put in, and that is definitely like your PE testing, and all of the Learning Hub data is your trainings that you go through, and then the Airmark data is from breakfast in the classroom. And based off of last year, we had 509 respondents last year, which is amazing. So we've had a great increase since the initiation in 2013-14 school year. The goal for this school year is to have 50 schools achieve Healthy CPS. So we're hoping, the goal is to always get all schools to respond to the survey. So that is all 667 schools. So hopefully we will make that for this school year. And this is based off of last year's data. So we had networks, this is by network. So network 5, 6, 7, we had 100% of schools fill out the survey, and then there's a little dip. And right now we just launched a new charter checklist that went out through our digest. So if anyone's looking for that information, if you're a charter school, we can give that to you because we want more charters to participate and also be healthy CPS. And last year, these are the schools who achieved healthy CPS. So we had 12. And like I said, our goal for school year 17-18 is to have 50. So hopefully these 12 will maintain their status, and we'll have more to go along with that. For those who don't know what the school progress report looks like, this is, you type in your school name on the CPS schools page, and then you'll see the Healthy CPS Indicator there. And soon, I'm not quite sure when CPS Tech will get the reports there, but you'll be able to go click on downloads on the school page, and you'll be able to download the actual report. If you want the report, we will be able to send it to your principal or your wellness champion. And this is what the report will look like. This is an example of buildings that you received 100%. And then here's the symbols here that can help you out. So based off of the criteria, you can use it against the checklist and against your survey. We recommend that when you're filling out the survey that you print off a copy so that you keep a record of your answers. And I know that once you're done filling out the survey, we also send an automated response of the answers that you submitted as well. But you can use that as a reference so you know exactly what you achieved and did not achieve for the checklist. And then there's a percentage for each badge. So if you didn't achieve 100%, it'll tell you how much you've achieved and how far you have to go. And if you want to stay more in contact or know more information, Healthy CPS, you always can email us, but sign up for our digest, and as well as have your principal designate a wellness champion or a Medicaid designee. And I'm going to turn it back over to Christy.
Great, thanks so much, Sarita, for that great overview of the Healthy CPS process and, just the plethora of resources your office offers. I think people really appreciate that. So while I introduce our next speaker, I'm going to release another poll question. And just to, again, get a feel for our virtual room here, the question is, what type of teacher are you? Are you in the classroom? Are you a PE teacher? Are you like a resource support staff or other? So while that's going, I want to introduce Kenneth Varner, who's our Community Engagement Manager at Healthy Schools Campaign. And he has the great honor of working with parents and community members to, create buy-in for all these healthy changes that are happening at the school level. So take a minute to answer. Looks like we need a few more folks to fill out the poll. And again, it's just as a reminder, feel free to chat in your questions. Sarita and Kenneth and Christy are great experts, so no question is too silly or, or too detailed. So please feel free to chat those in. All right, so it looks like I'm going to close the poll. And I'm going to share the results. So 14% are resource partners or staff, and the other are other staff members at the school. So there you go. All right, so I'm going to hide this, and it's back to you. All right, Kenneth, take it away.
All right. Hello, everyone. Again, my name is Kenneth Varner. I'm the Community Engagement Coordinator with Healthy Schools Campaign. And before I was in this position, I had the honor of working at a school on the south side of Chicago, serving as their wellness champion. So I do have firsthand knowledge on how to implement these things on the school level. So please, if you have any questions on that, please chat those in. So as we were just discussing the alignment report and the Healthy CPS Indicator, I wanted to go through with some common reasons why schools missed the mark. As you said, like 12 schools have achieved Healthy CPS this last school year, but a lot of schools did get close, and there's a couple common factors that we found and why they didn't quite make the mark. It can be something as simple as the survey was not filled out correctly. So we highly recommend that you work off of a paper copy, because that the survey can only be submitted once. And then sometimes you just didn't ask all of the right people. So when filling out the survey, please speak to everyone involved: the school nurse, the PE teacher, the administration, the lunchroom manager, other teachers. Everyone is going to have insight onto what's actually taking place in the school. So make sure you're speaking to everyone before submitting that survey. Sometimes you can just be unaware of specific requirements. So please make sure you familiarize yourself with the healthy snack and beverage policy, the PE policy, the local school wellness policy. Make sure you're aware of all of these things and what exactly is going to be asked of you. Sometimes you can have a situation where you may not have school staff that may be completely on board. For example, one of the requirements is that students not be held out of PE or recess due to discipline issues. That is something that we're asking the entire school staff to be on board with. So you're going to have to get buy-in from that one teacher that's holding out. Sometimes we understand that it is a situation where that can be your only leverage over a student, but it is very important that every student has access to all of those physical activity minutes. Sometimes you're going to have a situation where parents aren't on board. So it's their baby's birthday and they want to send in those cupcakes. However, we want to have those healthy celebrations instead. So try to work with your parents to find healthy alternatives to those celebrations. And just to be quite honest, sometimes it's just difficult to meet those requirements. Sometimes it doesn't feel like there's enough time in the day. But if you work together, we're asking that you find some creative strategies and to implement action plans in order to achieve these requirements. So speaking specifically with the Learn Well badge, in order to achieve this criteria, it's important that you establish a wellness team. And even though we're talking about the Learn Well badge right now, these techniques will be help you achieve all of the badges. So all of these are applicable. So first, establishing that wellness team. On that wellness team, you should have administration, teachers, students, parents, lunchroom managers, the school nurse. Everyone has a unique perspective and can help you brainstorm on creative ideas. So you'd want to review that alignment report that was mentioned. The alignment report is submitted to the principal at the beginning of the school year. So you want to see exactly where you fell short last year and highlight those so that you can achieve the Healthy CPS Indicator. Again, you'd want to fill out that checklist and create an action plan. And you'd want to do that as early in the school year as possible so you have enough time to achieve your goals. You want to familiarize yourself with the CPS policies, as I mentioned before. Develop a fundraising plan early in the school year. You also want to schedule some time to report to the local school council and designate exactly who that will be. And when you get your wellness team together, after you create your action plan, make sure you delegate responsibilities. We understand that everyone is busy, but I am the belief if everyone does a little, no one has to do a lot. So I highly recommend you delegate, delegate, delegate. It can be very hard if one person tries to take everything on themselves, but so if everyone works together, it is definitely achievable. And for the teachers that are not part of the wellness team, still try to bring them to the table and make sure you disseminate what your wellness team has decided to work on early enough so that the teachers can work that into their curriculums and into their lesson plans. So you want to make sure that you reach out to the other teachers in the building so they can participate in the strategy session early in the school year. All right. So there are definitely going to be some challenges to achieving the Learn Well badge. For one, sometimes it can be hard to form that wellness team. For one, teachers can think that it's going to be a significant time commitment because we know you're busy already. However, we're asking that wellness teams meet about once a month. You can do this at whatever is most feasible for you. There are some schools that meet before school. There's some schools that meet after school, depending on who's actually on your wellness team. So it's definitely flexible, but you want to meet about once a month. And when forming the wellness team, you want to identify staff that are genuinely interested in achieving these health and wellness goals. That is definitely the first step. Meeting your required minutes for physical activity, there are creative ways to go about that. Incorporating physical activity into your curriculums, into your classroom. There are some schools that use like the Go Noodle program. We ask teachers to be really creative here. You can build it into your lessons where you have those movement minutes, where you can actually take those like 5-minute movement breaks just to help the students refocus or to loosen out or work out the jitters. Or you can actually incorporate it into your lesson plan as to like it is part of the math class, as part of the science class to actually do that movement. In regards to rewards and celebrations, as I mentioned, reaching out to the parents early on is a great idea. So sending a letter home and letting them know your expectations, letting the other teachers in the building know that we're not going to be giving food as a reward. So a student does really great on a test or gets an answer right, we don't want to give them that little Snicker bar. Maybe we'll give them a pencil or a sticker. In regards to like birthdays, I had one school that told me they created a birthday sash that a student could wear around for that day. So instead of doing like the cupcake celebration, that person gets to wear a sash for the day telling it's their birthday. Maybe you have that student do the daily announcements that day. So there are other ways to reward students and to celebrate certain achievements in the school. Garden utilization can be something that's a little bit off-putting. People can be a bit apprehensive towards it. But just because we have a garden there doesn't mean everyone has to get their hands dirty every day. I know that's what like throws people off, but there are creative ways in which you can utilize the garden in your lesson plan. I saw one teacher take his students on a nature walk. It was a pre-K class, and they went out and just as the leaves on the trees were turning color, they went out and practiced their color recognition. So that is definitely like using your outdoor space in your lesson plan. You can do things like learn about the water cycle or just looking at bugs and photosynthesis and how plants grow. So there are different ways you can use the garden in your lesson plans. All right, now I want to talk to you briefly about how to prepare for the survey. So the survey is released in May. So you want to think about early spring, you want to review your action plan and your checklist just to kind of reassess where you are, and that way you'll have enough time to make any of those changes that are necessary. You're going to enlist one person to complete that survey. A problem that other schools have had is you have multiple people that are doing it and have different answers, but you want to make sure that one person compiles all the data. Hopefully this will be like the wellness champion. Make sure that they get everything together, and before they submit the survey, you want to review that with the administration before submitting, so you can double and triple check your answers before submitting that. And if anything does come up that ends up that you feel like missing or is correct, like Sarita explained, there is an appeal process. So you want to make sure that you have a copy of all the answers that you submitted and any documentation to prove that you're actually doing the things that you have answered on the survey, and just be prepared to talk to the Office of Student Health and Wellness if there are any incongruencies. With that.
Wow, look at us. We're so efficient. We've been able to just push through this webinar rather quickly, which is really exciting. So thank you, Kenneth. That was really helpful. All those tips and tricks for sure. Hopefully you took some notes and are feeling a little bit more prepared for the upcoming survey, which will take place in May. So we have plenty of time for questions and are going to encourage you to type those into your chat. I think on the right-hand side of your screen, you're going to see a little chat icon. Please feel free to type in your questions, and we are happy to answer them. Looks like we've got a question coming in right now. Specifically, it looks like this question is in regards to the new the new addition to the Learn Well badge. You talked about, I don't remember exactly what.
Safe and supportive environment.
Yeah, so the question is around that. And the question is, my religious views are in opposition to the LGBTQ lifestyle. Can I be forced to wear the badge?
The answer is no, you cannot be forced to wear the badge. It is in support of students and just creating a safe environment for all students. But no, you're not required to or be forced to wear it.
Okay.
Yeah, keep a values neutral approach.
Right. And I'd like to add a little bit to that. We know that people in our society that are identified as LGBTQ can suffer some bullying or being made fun of. And this is about creating a safe place or identifying certain people that student can then turn to if they're facing any issues. So you don't necessarily have to identify as such or be in support of any particular lifestyle, but it's all about creating a safe place where everyone can feel safe and happy and able to learn.
Thanks, guys. That's really helpful information. The next question has to do with the alignment report. It looks like this person is having some challenges getting that alignment report from their principal. So how can I get my school's alignment report if my principal isn't providing it?
You can get the report also from your wellness champion, but the principal has to designate a wellness champion, and then we can go from there and emailing it to the wellness champion. But once the reports are made live, so on the school progress report, and once you click that downloads tab from the school, by your school name, you'll be able to download their school report that way as well, once they're made available. But right now, we email it to the principal at the beginning of the school year, and then we can follow up and email it again to the principal and to the wellness champion.
And is there a timeline as to when that's going to be made available on there?
Unfortunately, I don't know the exact timeline right now because it was supposed to be made available a while back, but I'm not sure what's going on within CPS type world right now.
Great.
Yeah.
So it sounds like if you don't have access to it yet, you just need to have your principal help them make that available for the wellness champion. Okay, great. Another question coming in. They want to know so it sounds like this school particularly has some challenges around meeting those PE requirements because they only have one PE teacher. So Sarita, can you speak to that a little bit?
So yeah, the minute requirement for physical health education is 150 minutes. The way that we've mapped it out is 90 minutes should be designated to PE, and the rest can be designated, say, like health education. So that's 90 and 60. And also within health education, that is also sexual health education. So you could also put in some minutes toward that, so to make the full 150 minutes. So if you are teaching the sexual health curriculum that we have, and as well as getting your PE curriculum, you will meet that 150 minutes. And I will say, if you go on the Knowledge Center and you're teaching the sexual health curriculum, there is a great tool that we put on there, the sexual health implementation tool, and it notes every lesson that's going to be taught by grade level within sexual health and every minute requirement for those lessons. So it maps it out pretty well for you so that you know.
That's great. Yeah, that's really helpful. The next question is, what if we get most things but are just missing one thing from each category for each badge? How does that work?
Unfortunately, that just means that you have to meet that one thing as well in order to get that full badge. So it's pretty much all or nothing. And like you saw in the alignment report, at least you'll be able to see exactly how close you are to meeting that badge, what your percentage is. So you could be 90% away, 95, and you'll know the weight of the answers in a sense too, if you want to do a little math.
And I'll say it's important to identify those places where you fall short as soon as possible, so that you can start working. There's going to be hiccups along the way. You might run into some things that you didn't expect. So start now. Don't wait till April to start doing it.
All right, our next question, related to the particular presentation in the slides. So the question is, can you send the slides as well as where to go to access all of the information relating to the badges? So all that information is on this slide deck, and we're happy to send the slide deck to all attendees. That's no problem. We could do that for you. Should be able to do that later today or tomorrow. We've also recorded the webinar, and so we will make that available online. We have a Healthy Schools campaign has a YouTube page, and so we'll upload the recording and then send that out so that you guys know how to access that. Just so that everybody has a clear understanding of the expectations, our office actually shuts down for the holidays starting on Thursday, and so if we're not able to upload that recording before the holiday break, we will get that out to you right after the holiday break. However, I can absolutely send you the slide deck tomorrow so that you're not waiting for the webinar recording. So
you can also go on cps.edu and type in Office of Student Health and Wellness, and then everything is on that page. And if I have access to the Knowledge Center, which is mostly for inside CPS staff, you can also type in Student Health and Wellness, and everything concerning Healthy CPS is there as well.
Awesome.
I'd also recommend taking a look at the Learn Well toolkit. It's also on the resource page here. It has great templates from everything to forming your wellness team to suggestions on like healthy snacks that you can use in the school.
So lots of resources and tools available online. We did want to give you a list of some of the partners that are closely working with CPS to not only help them with the Healthy CPS Indicator, but specifically these are partners that offer various programs that will help you achieve those goals. So if you're struggling a little bit with nutrition education, you can look to the kitchen community as maybe somebody who can help you figure out some strategies around that. If you're needing some alternatives for physical activity, reaching out to someone like Chicago Run or Girls in the Game or Urban Initiatives, these are all vetted by CPS and are approved partners. So feel free to reach out to them so that you can talk to them about the various programs they offer to help you meet those requirements around the Healthy CPS Indicator. Additionally, here are some resources. As Kenneth and Sarita both mentioned, there's the Healthy CPS homepage, and that's going to take you to the CPS homepage, and then it's going to give you lots of information around the CPS Indicator, also the toolkit, which was mentioned. This is another great website is Alternatives to Denying Physical Activity. So if you're really one of those teachers who struggles to figure out how to get your kids physically active because sometimes you find that that's the most effective way to get them to behave, this is a really great resource to come up with some different ideas. So rather than withholding physical activity, which we know a lot of times those kids that act out are the ones who actually need that physical movement, you're actually shooting yourself in the foot. There's some strategies on that website. And then lastly, from Healthy Schools campaign, we have our Fit to Learn program. And that is our free professional development we offer Chicago public teachers, K through 5. And on that resource page, you're going to find a whole lot of information around, there's tip sheets on celebrations and rewards, nutrition education. There's also letter templates if you don't know how to ask your parents to send in healthy foods and snacks, there's a template for letters for parents on there that also includes a Spanish version. So please click on that and dig around and find some wonderful things that will help you in your efforts around creating a healthier school environment. Stay connected with us. So feel free to reach out. Again, my name is Christy Cox. There's my email. We have Sarita's contact information and Kenneth as well. And we're really here to help you be more successful. And we want to see all the schools achieve the Healthy CPS Indicator and are willing to do whatever we can to help you make those achievements. So we've wrapped up our webinar and ended a few minutes early. And we want to thank you again for spending the last 45 minutes of your time with us. And Again, I will send out the slide deck tomorrow, and in the meantime, hope you all have a wonderful and happy holiday season, and we look forward to a new school year in 2018. Thanks so much, everyone.